In the world of medicine, we often think we know the major players. When it comes to diabetes, you have likely heard of type 1 and type 2. But the medical community is now officially recognizing a different form of the disease. It is called type 5 diabetes. This is a significant moment for global health. The International Diabetes Federation made this official announcement just this past April, on April 8, 2025. This decision followed years of research and advocacy. It gives a name and a spotlight to a condition that affects millions of people, yet has remained in the shadows for far too long. This recognition marks a turning point for patients who did not fit neatly into other categories. For decades, doctors in parts of Asia and Africa saw patients with a unique kind of diabetes. These patients were often young and very thin. They had high blood sugar, but their disease did not look like typical type 1 or type 2 diabetes. This mysterious condition was once called malnutrition-related diabetes mellitus by the World Health Organization back in 1985. However, it was later removed from official classifications in 1999 because there was not enough clear evidence at the time. Now, with new compelling research, the global health community is finally giving this disease the attention it deserves, bringing hope to millions. The new name, type 5 diabetes, is more than just a label. It is a crucial step toward understanding and fighting the disease. Giving it a formal name helps to distinguish it clearly from other types of diabetes. This clarity is vital for doctors, researchers, and patients. It paves the way for developing specific diagnostic tests and effective treatments. Before this, patients were often misdiagnosed. They might have been told they had type 1 or type 2 diabetes. This could lead to incorrect and sometimes dangerous treatments. The official name helps to end this confusion and a new chapter of focused care. The journey to this recognition has been long. It began with observations by doctors on the ground and was propelled by dedicated researchers. A key moment was a meeting in India in January 2025, where experts drafted a consensus statement. Recent studies, like one published in 2022 by Dr. Meredith Hawkins, provided the critical metabolic data needed. Her work showed that the core problem was a severe lack of insulin production, not resistance to it. This scientific proof was the final piece of the puzzle. It confirmed that type 5 diabetes is a distinct clinical entity, deserving of its own place in medical textbooks, and more importantly, in clinical practice. So, what causes type 5 diabetes? The answer lies in a person's early years. The primary cause is chronic, severe undernutrition during childhood. When a child does not get enough food over a long period, it can cause lasting damage to their body. One of the organs that suffers is the pancreas. The pancreas is responsible for producing insulin, a hormone that controls blood sugar. In the case of type 5 diabetes, the beta cells within the pancreas, which are the body's insulin factories, are permanently damaged. This damage means the pancreas can no longer make enough insulin to meet the body's needs. This link to early life malnutrition is what makes type 5 diabetes fundamentally different from other forms. Type 1 diabetes is an autoimmune disease where the body's own immune system attacks and destroys the beta cells. Type 2 diabetes is primarily linked to insulin resistance, where the body's cells do not respond properly to insulin, often associated with lifestyle factors and genetics. Type 5 diabetes, however, is a direct consequence of a developmental injury. It is not about the body attacking itself or resisting insulin. It is about the insulin-producing machinery being broken from the start due to a lack of essential nutrients during critical growth periods. The damage caused by malnutrition is profound and irreversible. The beta cells in the pancreas don't just become weak, they are significantly reduced in number and function. This leads to a severe defect in insulin secretion. When a person with this condition eats food, especially carbohydrates, their pancreas cannot release the burst of insulin needed to process the sugar. As a result, the sugar stays in the bloodstream, leading to high blood glucose levels, which is the hallmark of all types of diabetes. This is a simple mechanical failure with devastating consequences for the individual's long-term health and well-being. Understanding this cause is critical for prevention. While we are now focusing on treating those who already have the disease, the ultimate goal must be to prevent it. This means tackling the root problem: childhood malnutrition. Improving nutrition for children in low and middle-income countries is not just about helping them grow strong. It is also about protecting them from developing chronic diseases like type 5 diabetes later in life. This discovery adds a new and urgent dimension to the global fight against hunger and poverty. It shows that the effects of poor nutrition can cast a very long shadow on a person's life. Type 5 diabetes is not a disease you will find equally everywhere. It has a specific geographic and demographic profile. The condition is most commonly found in low and middle-income countries, particularly across Asia and sub-Saharan Africa. It is estimated that 20 to 25 million people around the world are affected by this form of diabetes. These are regions where childhood malnutrition has historically been, and in many places remains, a significant public health issue. The prevalence of the disease in these areas directly mirrors the patterns of poverty and food insecurity, highlighting its deep connection to social and economic factors. The typical patient with type 5 diabetes is quite distinct. Most often, they are young men who are diagnosed between the ages of 15 and 30. A key physical characteristic is their very low body weight. They are lean, with a body mass index, or BMI, often below 19. This is a stark contrast to the typical patient with type 2 diabetes, who is often overweight or obese. The fact that these patients are so thin has been a source of confusion for many years. It made doctors question whether they had type 1 diabetes, but other key markers just did not line up correctly. One of the most important differences between type 5 and type 1 diabetes lies in the symptoms. While both involve high blood sugar and a lack of insulin, patients with type 5 diabetes usually do not develop a dangerous condition called diabetic ketoacidosis, or DKA. DKA is a life-threatening complication common in type 1 diabetes, where the body, starved of insulin, starts burning fat for fuel at a dangerous rate. The absence of DKA in type 5 patients was a major clue that something different was happening. Furthermore, they lack the specific autoimmune markers in their blood that are the defining feature of type 1 diabetes. This unique combination of features, young age, lean body, high blood sugar, low insulin, but no autoimmune markers or tendency for DKA, is what made type 5 diabetes so hard to classify for so long. Studies like the YODA study in sub-Saharan Africa were instrumental in clarifying this picture. Researchers found that a large portion of young adults with diabetes had this exact profile. They had low insulin levels, but did not have the classic signs of type 1. These findings helped build the case that millions were living with a distinct form of diabetes that demanded its own diagnosis and approach to care. The official recognition of type 5 diabetes is a monumental victory for patients. For years, individuals with this condition have been navigating a healthcare system that did not have a name for their illness. This often led to misdiagnosis and frustration. Now, with a formal name and diagnostic criteria on the horizon, patients can receive a correct diagnosis more quickly. This validation is incredibly important. It tells millions of people that their struggle is real, understood, and a priority for the global medical community. It also opens the door for more public awareness, reducing stigma, and empowering patients to seek appropriate care. With recognition comes the urgent need for treatment guidelines. As of today, in October 2025, there are no formal, internationally agreed-upon treatment protocols for type 5 diabetes. A working group has been formed to develop these guidelines, but they are not expected until 2027. In the meantime, doctors must be very careful. Because these patients produce very little insulin, they often need some insulin injections to manage their blood sugar. However, their bodies are also very sensitive to insulin. Giving them too much can be extremely dangerous, causing severe low blood sugar, which can be fatal, especially if they have limited access to food. Current thinking on management involves a delicate balancing act. Treatment may include small, carefully measured doses of insulin. This is often combined with oral diabetes medications that can help the body use its own limited insulin more effectively. Nutrition is also a critical component. Experts are suggesting a diet that is higher in protein and lower in carbohydrates. This can help maintain a healthy weight and prevent sharp spikes in blood sugar. This tailored approach is very different from the standard treatment for type 1 or type 2 diabetes, highlighting why a correct diagnosis is so important for patient safety. Ultimately, the recognition of type 5 diabetes will transform the future of diabetes care. It will attract much-needed funding for research to better understand the disease and develop new therapies. It will drive the creation of educational programs for healthcare providers in affected regions, ensuring they can identify and manage the condition correctly. Most importantly, it brings hope to a large and neglected patient population. By finally bringing type 5 diabetes out of the shadows, we are taking a critical step toward providing better, safer, and more effective care for everyone living with diabetes, no matter where they are in the world.